Thank you. I'm here today to tell you about the specific impacts of TB on Inuit communities. As we have already heard today, tuberculosis is a preventable disease. It is a social disease with medical characteristics. Factors contributing to the high rate of TB among Inuit include malnutrition, crowded housing, and poor ventilation, alcohol and drug abuse, and inadequate access to health care. Addressing these root causes are key to reducing the unacceptable high rates of TB in Inuit Nunangat, which is our Inuit homeland in Canada. To treat TB without addressing these underlying factors is like treating an injury with painkillers and not acknowledging the source of the pain. It will not go away. To put things in perspective, TB has been nearly eradicated among the Canadian-born non-Aboriginal population. In 2009, this group registered 1 case per 100,000 people. Rates among the general Canadian population are the lowest ever recorded. This is great news. In 2009, this was 4.7 cases per 100,000. Yet, TB rates among Inuit in Canada are similar to those seen in developing countries. Nearly 200 cases per 100,000, and they are getting worse. 2 years ago this month, we were here in this room to say that the TB rate among Inuit had doubled between 2004 and 2008, and that the Inuit rate had grown to 185 times the rate of the Canadian-born non-Aboriginal group. Well, today we are sad to report that that rate has grown once again. In 2010, it was 284 times higher. Over the past 2 years, Inuit from across Canada have taken action, collaborating on an action plan aimed at eliminating TB in our homeland. Our plan speaks to 3 broad objectives. It proposes an Inuit-specific approach to addressing TB in Inuit communities. It stresses the urgency of this issue, and it takes a holistic approach, addressing the medical and social causes of TB. TB will never be eliminated until housing is improved, food security is improved, and access to health care for Inuit is closer to what other Canadians take for granted. The action plan aims to define the way forward for Inuit, address social inequities, improve access to key medical equipment and care, and minimize the jurisdictional differences that complicate the detection and management of TB in our communities. That action plan will be formally released in the coming months, but until then, I am happy to have the support of Stop TB Canada and MPs from our largest political parties. The t-shirt that I am wearing says Taima TB, or Stop TB in our Inuit language. One of our immediate goals is to encourage young Inuit in their teens and 20s, those at greatest risk of contracting the disease and perhaps less likely to see a doctor, to get tested and get treated before they get sick. Look for these shirts and other efforts aimed at raising awareness to Stop TB in my lifetime. Thank you.